The client teaching aspect of nursing is a vital important step in healthcare. It provides the opportunity for decreased hospital stays, decreases complications, and can reduce symptoms associated with illnesses or surgeries. The ANA, Standards of Clinical Practice, and most state Nurse Practice Act include client teaching in the professional role of an RN. The lack of client teaching can lead to legalities, such as risk of civil liability and negligence. Not to mention, the responsibility of the RN is to provide thorough health care promoting good health through client teaching. When completing this lesson, you should be able to identify principles of client teaching, apply principles of client teaching, assess client learning needs, diagnose client learning needs, and develop a teaching plan for your client, and to recognize barriers to learning. Nurses are the key educators in healthcare. Teaching a patient is done to assist in the prevention of illness or the promotion of wellness. Nurses teach patients what they need to know about their disease or disorder, their diet, their medications, their treatment, and self-care. The patient must be taught how to care for herself or himself at home before discharge. Discharge planning requires looking ahead to what the patient will be facing when returning home. It is a process that begins at the time of admission. Remember why we are teaching. It's to increase the quality of life. You want to establish trust and a partnership with the learner. Client motivation signifies the readiness to learn. Use a variety of teaching styles with the individualized strategies and materials to meet those clients' needs. Capitalize on their strengths and resources, simplify the language, and consider the client's developmental stage. While you provide client teaching, be sure the environment is a calm, quiet environment that will allow the client to focus on the material being presented. If the TV's on, you might want to shut it off. Use content sequencing while providing repetition and practice. Relate the new learning experience to the client's past and reinforce newly learned behaviors. The teaching and learning process. Teaching includes the following steps: assess, diagnose, plan, implement, and evaluate. Client teaching is most effective when approached through the nursing process. Instead of considering client teaching as a separate process, it must be integrated into the client care. This provides the RN the opportunity to provide education about the client's health care during all interactions with the client. The assessment portion of the teaching-learning process can be accomplished by answering the following questions during client interactions, such as: what does the client already know? What does the client think is happening, and why do they think it's happening? What does the client need to know? What worries the client most? What does the client want to know? And how does the client feel about managing their own health care independently? Assess factors affecting learning before beginning to teach. You must assess the patient's ability to learn, their vision, hearing, impaired motor function. You also want to assess cultural factors and expectations to work within the patient's values and cultural system. According to Harrington and Terry in your textbook, after collecting the necessary data, the nurse analyzes the information and identifies the nursing diagnosis that most clearly describes the client's learning needs. According to Nanda, there are two approaches to diagnosing learning needs. There is deficient knowledge and readiness for enhanced knowledge. The nurse must choose the style of diagnosis. Regardless of the choice, both approaches provide the nurse the direction for nursing care and education interventions. Diagnose the learning needs of your patients so that you can build upon their current knowledge. Never assume patients are literate or illiterate. They may be able to read multiple languages, or they may not be able to read at all. Know their educational level. How can you assess a client's reading ability? One example that I have used is to hand educational material to the client upside down and see if the client turns the material around. Readiness to learn and motivation plays a large role in getting the patient ready to learn. Optimum learning takes place when the patient has a purpose for acquiring new information. Make sure you give time to rest in between education. If a client is extremely tired, they are not going to understand, comprehend, or retain the educational information. There are standardized plans that have been developed. Remember, when you're using these standardized plans, to revise them to be individualized for the client. Develop a plan to meet specific goals and identify the interventions the client will need to perform to meet these goals. Develop a teaching plan and work with patients to show them the advantages of learning what they need to know. Resources for teaching include videotapes, pamphlets, and handouts on equipment. People learn in three ways. There's visual learning with the eyes, auditory learning with the ears, and kinesthetic learning by what they do and touch. Best to include all three methods of learning in your teaching plan for the client. The three main learning domains are cognitive, affective, and psychomotor. Cognitive involves mental skills, knowledge, and the development of intellectual skills. Teaching can be provided by lecture, discussion, simulation in different contexts, or independent study. Affective, manner in which we deal with things emotionally. Teaching can be provided by discussion, values clarification, role-playing, role modeling, and simulation. And then there is psychomotor, use of motor or physical skills. Teaching can be provided by demonstration with return demonstration, guided practice, and independent practice. When implementing the teaching plan, stay alert and be sensitive to the client's needs and responses. When possible, include family members or support persons. Arrange to do the teaching in a quiet place. Few distractions, one-on-one or in a small group. Sit with the patient. Involve the patient. The best time for teaching a patient is when they are physically and psychologically ready. When providing client teaching process, there are some considerations. When teaching a child, it's best to keep within the child's abilities and use concrete methods. Play techniques can be successful. You can also use dolls or toys. Must be done in short segments for short attention span. And when teaching the elderly, the pace is slowed to allow more time for the processing of information. A few more considerations. If there is a loss of vision, speak directly in front of the client to prevent startling the patient. Turn off the TV and limit distractions. Provide good lighting, printed materials, or glasses if necessary. Make sure they have their hearing aids in if they have hearing aids. Use short sentences. Use medical terms to a minimum, and review for comprehension. Writing down the steps of a procedure helps the elderly person focus and integrate the information. It also aids recall of the information and assists in diminishing any sensory distractions. Evaluating by the use of a return demonstration should be included with each ongoing teaching section. Include a review of what has been learned. Then ask the patient to demonstrate doing the procedure or task. Evaluation is the critical step in the learning process. It involves obtaining feedback. This feedback is the return of information about the process. And and establishing rapport and trust are essential to effective teaching. Evaluation of an individual teaching plan should include the achievement of desired outcomes, adequacy and appropriateness of teaching materials and/or methods, and the effectiveness of the nurse as a teacher. Some questions you may ask yourself during the evaluation process is, did the client achieve the learning objective? How was I the most or least helpful to the client's learning? What factors facilitated or blocked the client's success? And how could I improve this teaching session next time, and be sure to include the client's feedback and perception as well into your evaluation. There can be client-teaching barriers. Some of the issues affecting client education can be nurse's own education and background, the client's preconceived ideas about his own health and healthcare issues, and the client's ability and willingness to learn. Barriers to learning can include language. Does the teacher and the student speak the same language? If not, is there a third-party translator available? Continuing with barriers to learning, know your client's religious and cultural beliefs. Not understanding their cultural or religious or spiritual beliefs can actually cause issues to learning. Know their literacy. Can the patient read? And if so, what grade level do they read at? Can they comprehend what they read? And if so, what grade level? Offer other methods of learning, such as using diagrams, demonstrations, or other techniques. Then the other barrier you may have heard of is non-compliance. Think about this for a minute. Nurses can actually jump to the conclusion that a patient is non-compliant or just unwilling to learn, when it may be that the patient cannot read and is ashamed to tell anyone, or maybe they don't understand. Therefore, assessment of the patient's learning abilities and preconceived notions is a vital first step in effective patient education. The RN plays a major role in meeting the public's health education needs. The nurse-client interactions provide an excellent opportunity for ongoing healthcare education. This concludes this lesson. If you have any questions related to the client teaching and learning content of this lesson, please contact the instructor.